Welcome to our deep dive into the anatomy of the heart and pericardium. In this video, we'll explore the structure, function, and clinical significance of the pericardium, the protective sac that surrounds the heart. Whether you're a medical student or simply curious about how your heart is protected, this journey will give you a clear understanding of these vital anatomical features. Let's begin by setting the stage with a brief introduction to the pericardium and its relationship to the heart and surround. Pericardium is a conical fibrosurous sac that encloses the heart and the roots of the great vessel. It's located within the middle mediastinum, lying just behind the sternum and between the second and sixth costal cartilages. Posteriorly, it's related to the esophagus, descending thoracic aorta, and the bodies of the fifth to eighth thoracic vertebrae. This strategic positioning helps protect the heart and maintain its optimal function within the chest cavity. Pericardium serves several essential functions. It protects the heart by absorbing shocks, restricts excessive movement, and prevents the heart from overexpanding. Additionally, it prevents kinking of the great blood vessel and minimizes friction between the heart and surrounding structures. These roles are crucial for maintaining the heart's stability and ensuring smooth, efficient cardiac function throughout life. Better understand the pericardium's structure and location, let's take a closer look at its anatomical relationships. Notice how the pericardium envelops the heart and is positioned among other vital thoracic structures. This visualization helps us appreciate the protective and supportive role it plays within the chest cavity. Here, we see the pericardium in relation to the heart and major vessels. This perspective highlights how the pericardium not only encloses the heart, but also integrates with the roots of the great vessel, providing both protection and structural support. Understanding this context is vital for grasping the pericardium's full anatomical significance. Pericardium is divided into two main parts, the fibrous pericardium and the serous pericardium. The fibrous pericardium forms the tough outer layer, while the serous pericardium is a double-layered inner sac. The serous pericardium itself consists of a parietal layer lining the fibrous pericardium and a visceral layer, also known as the epicardium, which covers the heart's surface. These subdivisions work together to provide both strength and flexibility. Fibrous pericardium is a cone-shaped, thick sac made of fibrous connective tissue. It forms the sturdy outer layer of the pericardium, enclosing the heart and fusing with the roots of the major vessel. Its conical shape, with a distinct apex and base, helps anchor the heart within the chest and provides a strong protective barrier against external forces. Fibrous pericardium is connected to the sternum by ligaments at the front and is related to the principal bronchi, esophagus, and descending aorta at the back. On each side, it's adjacent to the mediastinal pleura, phrenic nerves, and pericardiophrenic vessels. These relationships help keep the heart in place and protect it from shifting or injury. Looking deeper, the fibrous pericardium's connections and relationships with surrounding structures become even more apparent. Its robust design ensures that the heart remains securely positioned while still allowing for the necessary movement during each heartbeat. This balance of stability and flexibility is essential for healthy cardiac function. Summarize, the fibrous pericardium is a tough, cone-shaped sac that not only protects the heart but also keeps it anchored within the chest. Its connections to the sternum and other thoracic structures are crucial for maintaining the heart's position and ensuring its optimal function. Moving inward, the serous pericardium is a thin, double-layered sac that lies within the fibrous pericardium. It's lined by a simple squamous epithelium called mesothelium, which helps reduce friction. The serous pericardium is divided into two layers, the parietal layer, which lines the inner surface of the fibrous pericardium, and the visceral layer or epicardium, which covers the heart's surface. Visceral layer, also known as the epicardium, covers the external surface of the heart and the roots of the great vessel. It's separated from the heart by subserous areolar and fatty tissue, as well as blood vessels. The visceral layer is continuous with the parietal layer along the roots of the great vessel, forming a seamless protective covering. Between the parietal and visceral layers of the serous pericardium lies the pericardial cavity. This potential space contains a small amount of serous fluid, usually around 15 to 20 milliliters. The pericardial fluid acts as a lubricant, reducing friction as the heart moves within the pericardium during each beat, ensuring smooth and efficient cardiac motion. Inside the pericardium, you'll find not only the heart, but also several major blood vessels. These include the ascending aorta, pulmonary trunk, lower half of the superior vena cava, terminal part of the inferior vena cava, and the terminal parts of the pulmonary veins. This arrangement ensures that all major inflow and outflow tracts are well protected within the pericardial sac. Pericardium receives its blood supply from several sources. The fibrous and parietal layers are supplied by branches of the internal thoracic musculophrenic artery and the descending thoracic aorta. Venous drainage occurs through the azygos and internal thoracic veins. The visceral pericardium, on the other hand, is supplied by the coronary artery and drained by the coronary sinus. Nerve supply to the pericardium is equally fascinating. The fibrous and parietal pericardium, which develop from somatopleuric mesoderm, are innervated by the phrenic nerves and are sensitive to pain. In contrast, the visceral pericardium, derived from splanchnopleuric mesoderm, receives autonomic innervation from branches of the sympathetic trunk and vagus nerve and is insensitive to pain. Elaborate, the somatic innervation of the fibrous and parietal pericardium means that inflammation or injury here can cause sharp, localized pain. Meanwhile, the visceral pericardium's autonomic innervation means it does not transmit pain in the same way, making certain heart conditions more challenging to diagnose based solely on pain. Understanding the anatomy of the pericardium is crucial for clinical practice. For example, the transverse pericardial sinus is significant during cardiac surgery, as a temporary ligature can be passed through it to block blood flow through the aorta and pulmonary trunk. This anatomical knowledge directly impacts surgical safety and outcome. Pericarditis is the inflammation of the pericardium. When this occurs, the smooth surfaces of the serous pericardium become rough, resulting in a pericardial friction rub. This can be heard as a rustling sound, similar to silk when using a stethoscope. Recognizing these clinical signs is essential for timely diagnosis and treatment. Pericardial effusion refers to the accumulation of excessive fluid in the pericardial cavity. This can result from various causes, including congestive heart failure, pericarditis, tuberculosis, kidney failure, or heart surgery. The increased fluid puts pressure on the heart, preventing it from filling properly and often causing chest pain. Symptoms of pericardial effusion arise due to the pressure exerted on the heart, which prevents the chambers from filling completely. This can lead to chest pain and other complications. Recognizing these symptoms early is vital for effective management and prevention of further cardiac compromise. Classic sign of pericardial effusion on a chest radiograph is the water bottle heart. This refers to an enlarged cardiac shadow that resembles the shape of a flask or water bottle. Such radiographic findings are important clues for clinicians in diagnosing pericardial effusion and initiating appropriate treatment. Cardiac tamponade is a life-threatening complication of pericardial effusion. It occurs when the inelastic nature of the tough fibrous pericardium compresses the heart, severely restricting its ability to pump blood. Immediate recognition and intervention are crucial to prevent cardiac arrest and save the patient's life. Radiographic imaging is a key tool in diagnosing pericardial effusion. The enlarged cardiac shadow seen on chest X-ray provides a visual confirmation of excess fluid around the heart. This imaging helps guide further management and treatment decisions. Beyond X-rays, other imaging modalities such as echocardiography and CT scans can provide detailed views of the pericardium and help assess the extent of effusion or inflammation. Accurate imaging is essential for planning interventions and monitoring patient progress. Pericardiocentesis is a procedure used to aspirate excess fluid from the pericardium. The patient is positioned supine, with the head of the bed raised by 30 to 60 degrees to bring the heart closer to the anterior chest wall. This positioning facilitates safer and more effective fluid removal. There are two main approaches for pericardiocentesis. The subxiphoid approach involves inserting a needle at the left costoxiphoid angle with an upward inclination of about 45 degrees. Alternatively, the parasternal route introduces the needle into the left fifth or sixth intercostal space under ultrasound guidance. Both methods aim to safely remove fluid and relieve pressure on the heart. Thank you for joining us on this exploration of the heart and pericardium. We've covered the anatomy, functions, clinical significance, and key procedures related to the pericardium. Understanding these concepts is essential for anyone studying medicine or interested in how the heart is protected and supported within the body. Stay curious and keep learning about the wonders of human anatomy. Let's quickly recap the key points about the pericardium. It's a double-layered sac that protects the heart, restricts its movement, and prevents overexpansion. Its unique structure and strategic location make it essential for cardiac health. Remember, the pericardium is not just a passive covering, but an active participant in heart function. Understanding the pericardium's anatomy is crucial for diagnosing and managing conditions like pericarditis, pericardial effusion, and cardiac tamponade. These conditions can have serious consequences if not recognized and treated promptly. Medical professionals rely on their knowledge of pericardial anatomy to guide both diagnosis and intervention. Pericardium's protective mechanisms include shock absorption, restriction of excessive movement, and prevention of overexpansion. These features work together to ensure that the heart remains safe and functions efficiently, even under varying physiological conditions. Pericardium's anatomical relationships with the sternum, vertebrae, and major vessels are vital for its function. These connections help anchor the heart and provide a stable environment for cardiac activity, highlighting the importance of spatial orientation in anatomy. Serous fluid within the pericardial cavity acts as a lubricant, reducing friction between the heart and pericardium during each heartbeat. This simple yet effective mechanism is essential for the smooth operation of the heart, preventing wear and tear over time. The epicardium, or visceral layer of the serous pericardium, is the outermost layer of the heart. It not only provides protection, but also houses blood vessels and nerves that supply the heart, playing a direct role in cardiac health and function. The parietal layer lines the inner surface of the fibrous pericardium, blending seamlessly with it. This layer forms part of the protective barrier and ensures that the pericardial cavity remains a closed, frictionless environment for the heart. Recap: the pericardium's blood supply is complex, involving multiple arteries and veins. This ensures that both the fibrous and serous layers receive adequate oxygen and nutrients, supporting their protective and functional role. Dual nerves supply to the pericardium, somatic for the fibrous and parietal layer, autonomic for the visceral layer, explains the different pain sensation experienced in pericardial diseases. This knowledge is vital for accurate clinical assessment. Pericardial friction rub is a classic clinical sign of pericarditis. It's detected by auscultation and is characterized by a scratchy or rustling sound. Recognizing this sign can lead to early diagnosis and treatment, improving patient outcome. Imaging plays a crucial role in detecting pericardial effusion. The water bottle heart appearance on chest X-ray is a telltale sign, prompting further investigation and timely intervention to prevent complications like cardiac tamponade. Cardiac tamponade is a medical emergency resulting from rapid accumulation of fluid in the pericardial cavity. The heart becomes compressed, leading to decreased cardiac output and shock. Immediate pericardiocentesis is often required to relieve the pressure and restore normal function. Pericardiocentesis involves careful needle insertion to aspirate fluid. The choice of approach, subxiphoid or parasternal, depends on the clinical scenario and imaging guidance. Mastery of this procedure is essential for emergency and cardiac care specialists. In summary, procedures like pericardiocentesis are life-saving interventions for conditions such as cardiac tamponade and severe pericardial effusion. Understanding the anatomy and clinical context ensures safe and effective treatment. The study of the pericardium is not just academic, it has real-world implications for patient care. From diagnosis to intervention, a solid grasp of pericardial anatomy empowers clinicians to make informed decisions and improve outcomes. Anatomy is a foundation for all medical practice. By understanding the heart and pericardium, you're building a base for more advanced studies and clinical skills. Keep exploring and remember that every detail matters in the world of medicine. I hope this comprehensive overview of the heart and pericardium has deepened your understanding of these vital structures. The interplay between anatomy and clinical practice is what makes medicine both challenging and rewarding. Thank you for watching, and stay tuned for more insights into the wonders of the human body.